speed up the number of vaccinations being administered, the centre has said to states the weekend before India's COVID vaccination drive will open up for those over 60 and for those over 45 years with comorbidities, and at both government and private hospitals. The decision to significantly open up the vaccination drive with this rollout for the general public from Monday comes at a time when India could be on the brink of a second wave of infections, as India's cases, remember, have begun to inch upwards. Now, the centre has told states to speed up vaccinations. A list of eligible hospitals where the vaccines will be administered has been released. Those eligible have to make their bookings and book their appointments through the Covid 2.0 or the Arogya Setu app. Walk-in registration vaccinations will be allowed if the vaccine dose is available at the centre. However, no vaccines are going to be administered this weekend as the Covid 2.0 app needs to be upgraded. This digital platform will be transitioning this weekend from Covid 1.0 to Covid 2.0. And states have also been asked to strictly enforce SOPs, strict surveillance to contain cases, because remember, several states are showing a resurgence in COVID cases. In fact, India's average daily cases are now higher than it was a month ago at 14,300 right now. So what do you need to know if you're over 60 or if you're over 45 years of age with comorbidities? Let's go across to Arvind Gunasekar. Arvind, where does one go? How does one register? What documents does one need? What do we need to know?
Sarah, the government is gearing up for the next phase of COVID vaccination program. The next phase of COVID vaccination program will cover the age group of above 60 and also those with above 45 with comorbidities. So the next phase of COVID vaccination program for the COVID-19 virus will begin from March 1st. So government has made several changes when it comes to the next phase that also includes walk-in registration. Also, even those people who can directly walk in and they can register themselves and then they can take the shot from both the private hospital and also the government hospital. Earlier in the first two phases, we saw only the government hospitals were allowed for the COVID vaccination program. But from the next phase, even the private hospitals are also allowed in this particular program. The 24,000 private hospitals have been selected for the next phase of COVID vaccination program, along with the 10,000 government hospitals. So all those private hospitals that are empaneled under the Prime Minister Jan Arogya Yojana and also central government and state government health insurance schemes will be allowed for this COVID vaccination program. Though the vaccination will be done for free in the government hospitals, the price for the private hospitals is yet to be decided. What we are being told from our sources is that the price will be announced on Sunday. So coming to the question that you asked, the beneficiaries should register themselves in the Covid 2.0 version app. That particular app will be released on 28 on Sunday. That's what our sources are also hinting at. And the people, they need to show either their photo ID card, including electoral voter ID card and also Aadhaar card and also other government ID cards to be an eligible beneficiary. So that's something that relates to the public. And also what the big challenge before the government as of this moment is that government had an estimation of somewhere around 3 crore, including the healthcare workers and also the front care workers in the first two phases of COVID vaccination program. But as on date, only 1.7 crore vaccination has done. That is less than 50% has done. So that's something, a big challenge for the government to bring the people for the COVID vaccination program. So the government has advised the state government to speed up the program so that the vaccination program can be done across the country.
I just want to check, it seems to be very tech heavy. So people above 60, we're guessing elderly people who may not have that much comfort when it comes to applying online, etc., they will be allowed to go in for this. That's why they have the walk-in option?
Yeah, Sarah, they can go directly. They can go to the vaccination center and then they can show their ID card, and then the person who will be there, that particular person will register them on the Covid 2.0 app, and then they will be getting the shot.
All right, somebody will then register them on the app right then and there. Thanks so much. Thanks, Arvind, for clarifying that.